Hi there, my name's Ashley. I'm going to be the nurse helping you out with your discharge today. Looks like the doctor is sending you home on Meropenem, which is also known as Merum. This is going to be a carbapenem antibiotic, and this guy is a broad spectrum antibiotic where we actually use it for resistant bacterial infections. So this could be anywhere from multiple microorganisms, also known as microbial, bacterial meningitis, which is the protective membrane covering the brain and spinal cord. You also have skin infections, intra-abdominal infections, as well as drug-resistant infections. So this guy's going to cover all those and help treat that. How this guy works, so it actually breaks down the cell wall synthesis, causing cell lysis and death, so it keeps it from spreading. Some things we want to note, we're going to typically administer every 8 hours through IV infusion. And so we want to make sure we have access to that IV, make sure it's staying clean, clear, and patent. We also want to note for any renal function, especially patients with pre-kidney issues. It's just something we need to be monitoring and stay on top of. That way we know what the kidneys are doing. We're also going to look at your white blood cell count, which is necessary to evaluate how the treatment is actually working, and lets us know kind of, do we need more, do we need less, do we need to change drugs. So this is just going to kind of give us an overview of what's happening with the treatment. There's no specific requirements for taking it with food. So if it upsets your stomach while with no food, then I definitely recommend getting something in your stomach next time. That might help settle it a little bit. And then inflammation of the colon. So just something to make note of. Let us know if there's any side effect or any signs or symptoms that we need to be aware of down there. Please let us know, because this is something to make note of. So speaking of that, we also want to make sure we're looking out for any super infections. It can also cause headache, dizziness, rash, possibly a little bit of nausea and vomiting, and diarrhea. So just keep monitoring down there and let us know what's going on. That way we know if the med's being effective, or if we have something bigger like C. diff going on. So when to call the provider. This is going to be when you start to see any signs of an allergic reaction. So this can include like difficulty breathing, swelling of the face or the throat, or even hives. You also want to make note of severe gastrointestinal symptoms. So this could be persistent diarrhea, especially if it's watery or bloody. Definitely want to give us a call and get in here so we can see what's going on. You also want to give us a call if there's new or worsening neurological symptoms, something like seizures, confusion, or even like a severe headache. So not just a headache, because that's one of the side effects, but when it's severe, that's when you want to give us a call. Also want to monitor for the super infections, again, for that C. diff. So this is fever, chills, a new rash, or even a persistent cough. And then lastly, give us a call if you have any signs or symptoms of renal impairment, which could look like reduced urine output or flank pain, which is on the side here, or even high in the back. So if you have any of these pains, please give us a call so we can see what's going on. If you don't have any more questions for me, then let's get you signed in and get you out of here.